next speaker here, Julie Schwarz. She's our social worker with our neurology department, more specific to our stroke patients. And she's been with us for quite some time, even since I was a resident. And so I know her very well. And she's going to be talking about opportunities for connection and healing with our stroke patients and kind of dissecting, the emotional burden of our stroke patients, as well as how we can have a sort of connection to them as they recover and progress through their stroke in the outpatient side.
Thank you. So today I'm going to talk about the need for emotional support, the human connection in order to facilitate stroke recovery, as well as finding acceptance when recovery is not possible and the patient is nearing the end of their life. And I know I'm preaching to the choir about this. Most of you already incorporate what I'm going to talk about into your clinical interactions with patients and families. But I'm speaking about it as a way of reminding everyone that that having a stroke is frightening and potentially life-threatening experience. For many people, are we okay?
Yeah.
Oh, okay. For many stroke survivors and their loved ones, the trauma of having a stroke is so sudden and so life-changing that everything is different after the stroke. In working with stroke survivors and their families, their emotional response to stroke feels more like the trauma of a car accident than the gradual onset you see with most medical issues. As we've heard today, major advances in the treatment of acute stroke and in stroke rehabilitation have resulted in more people surviving and recovering well from their stroke. Despite these advances, many stroke survivors and their loved ones struggle emotionally after the stroke. Indeed, people with milder strokes may be the most vulnerable to isolation and depression, as friends and family may minimize the trauma of having a stroke, the difficulty of rehab, the frustration of not being able to speak as fluently as they once did, and feeling slower with their cognition. Patients who recover well are acutely aware that they are not the same as they were before the stroke, and this can cause emotional distress. Many stroke survivors talk about no longer feeling safe in their own bodies and live with the fear that death and disability can come suddenly. They transition from the safety of thinking it will never happen and now think it is always going to happen. Medical professionals often try to reassure their patients by talking about the calculated risk of another stroke and what it's based on with research, but what patients really need to hear is that their neurologist understands the emotions that they feel, the fear, the grief, the loss, the sadness. And then they are able to understand the risk and the more intellectual piece of it. Isolation and depression are very common after a stroke for both the stroke survivor and their caregiver. Research indicates that at least a third of stroke survivors experience depression at some point after their stroke. The limited amount of research on rates of depression for caregivers makes clear that rates of depression and anxiety in caregivers is also very high. Post-stroke depression can have many causes, including the stroke itself, but we all can understand as human beings that having a stroke and recovering from a stroke is a very difficult and depressing experience. Isolation contributes to depression in both survivor and caregiver. Issues such as difficulty with communicating, walking, eating, memory, and executive functioning can limit a survivor's ability to interact with others, as well as limit their interest in being with others. Embarrassment about deficits can increase isolation and make it harder for survivors to seek the social support that they need. For example, many stroke survivors have talked with me about how they don't feel comfortable eating out because they're embarrassed if food dribbles out the side of their mouth, or they have a hard time ordering because of their aphasia. Others have difficulty in groups of people, listening to more than one person at a time, and they get overwhelmed. It's no surprise that the COVID pandemic has made isolation worse for stroke survivors and their caregivers. This increased isolation depression has put more of the burden on caregivers. So respite care, normally something they would seek from paid caregivers or family members, suddenly felt life-threatening. Even now, 2 years into the pandemic, with vaccines easily available, the disruption of social networks that support stroke survivors has not returned to pre-COVID levels. As everyone knows, but it is always worth repeating, having good support improves stroke recovery and improves the quality of life for survivor and caregiver. Patients with poor social support networks end therapy sooner and make less progress in their recovery. I spend a lot of time with families encouraging them to identify the people in their lives who they can depend on and who are supports for them. By encouraging them to reach out, this not only helps them identify the people who can help them get through this difficult time, but it gives them permission to ask for help. So many families talk about how they don't want to burden their loved ones with the pain and suffering that they're going through. But sharing experiences and receiving support lessens the individual burden. Depression and isolation ease when we feel connected and heard by other people. Not only are the people in a patient's family and social lives important, but the medical professionals who work with them provide important emotional support and connection. Patients are more likely to take advice of a professional who they feel cares about them as an individual. When treatment ends or becomes less frequent, many patients mourn that lost relationship with their provider. One of the regular topics among the members of the stroke support group I facilitate is the feeling of being lost when physical, occupational, and speech therapy end. They miss their therapist. Often they know that they have made significant progress in their rehabilitation and they know what they need to do to continue, but they just feel lonely. When a patient dies, that relationship with the medical team is also lost, and many caregivers, widows, widowers, feel that loss. Okay. As an outpatient neurology social worker, I have to give a plug for having clinical social workers in the outpatient neurology clinic to work with patients and families on the emotional issues that arise from stroke and other neurological conditions, and to help them navigate the complex systems of getting medical care. I feel so fortunate to be able to spend my days helping patients and families with the emotional issues that arise from stroke. Sadness, grief, anxiety, worry, relief, joy, and fear are some of those emotions. And I'm able to provide them with guidance on how to navigate the complicated worlds of medicine, rehabilitation, disability benefits, health insurance, and many others. When the neurologists see a patient or their family members are struggling, they're able to refer them to social work so we can provide the support, psychoeducation, and referrals to resources that these patients need. Social workers also spend time with families who are faced with transitioning their loved ones to hospice. This decision is always emotional and filled with doubt and worry. On top of that, many people do not understand what hospice can provide or even what it means to be on hospice. Working with the patient's neurologist, we are able to help a family explore their feelings, concerns, and beliefs about the end-of-life care to reduce suffering and pain and to connect families with support at the end of life. One of the best ways to help stroke survivors and their loved ones find support and connection is by encouraging them to join a stroke support group. I facilitate the group here, and it's truly a wonderful experience to see the support and encouragement that the group members give to each other. Our group is open to all stroke survivors and their caregivers, loved ones. For many spouse caregivers, it's the first time they've ever engaged with anyone else who's in a similar situation. Seeing group members nodding their head in agreement and talking about their similar experiences offers invaluable support. Group members often encourage spouse caregivers to seek the support and respite they need so they can continue to be caregivers for their loved ones. When I talk with patients and families about joining the group, many people think that it will be a depressing group of people complaining about their stroke and their disability, but it's the exact opposite of that. The stroke support group is full of positive, accepting, and encouraging people, and pretty much everybody leaves with a smile on their face. I can't overstate how meaningful it is for more recent stroke survivors to see people who have lived with their stroke for a long time and are living and thriving and have recovered in many ways. Stroke support groups can also be an easier re-entry to being with others because nobody at group cares if they eat, and the food falls out of their mouth, or if they need help opening their soda, or whatever. If they have a hard time talking, getting the words out, they've all been there. It's worth noting that the group that I lead has been virtual since June 2020. And while it's certainly not the same as the in-person connection that we used to have, it's been very meaningful. It's actually been so meaningful that the virtual group will probably continue even after whenever this happens, we're able to go back in person. Having a virtual group enabled us to allow people who can't get out either because of their disability or because Houston traffic makes it impossible to get to the Med Center. So that's been really important. One caveat about seeking support through the stroke recovery process is that it's very important not only to encourage stroke survivors to seek support from friends and family, but to give them permission to ask for the right amount of support. One of the most popular and honestly volatile topics with the stroke support group is this topic of how much assistance versus how much to let a stroke survivor try it out on their own. The worry and anxiety that caregivers feel about the risk of a fall, injury, or even another stroke can limit the stroke survivor's recovery. They have to be able to push, within safe limits of course, out of their comfort zone in order to improve. Caregivers often look to medical professionals for permission to let their loved ones push through the rehabilitation. Finally, I think it's so important for long-term stroke survivors to engage in something. Religious groups, community groups, senior organizations, their family support groups, something of significance that gives them meaning and purpose and hope and community. We all need connection with others and to give to others to feel meaningful in life. That's it.
Thank you, Julian. Thank you for everything that you're doing for our stroke patients. Having been part of one of these and having had the opportunity to be involved in that, I think it's a very invaluable tool for our stroke patients. So one question I have is, as much as the stroke patient is front and center here, what have you noticed in terms of the caregiver, in terms of the burden or the challenges in providing support to that patient population, or at least that part of the population that may be a little bit different than just the stroke patient themselves?
Right, so a lot of my focus is actually on the families. I get a lot of calls from spouses, who talk about their frustration and how they can best help their loved one. And understand the deficits and get through that. I really find in the stroke support group that, and I say this all the time, that the caregivers really get more support than the stroke survivors do, because they have so much more around them, whereas the spouses, their world has been turned completely upside down. But they're not doing PT and OT. They're sitting in the car because of COVID restrictions waiting to pick them up. And so for a lot of them, being with other spouses has been really invaluable.
Great. Okay. All right.